My partner swears by the pull-out method and his legendary self-control.
I'm Dr. Karen Aminiampon. I take care of women's health, so everything women. Sex is not dirty.
Sorry, mommy. My doctor says losing weight could help my PCOS symptoms.
So if you're on, for example, your second round, or not you, if someone is on their second round.
How many times can one get an abortion before that constitutes as too much?
For the people that say I'm too loud, that sometimes I do too much, I'm here to shake tables. I'm here to cause a little chaos. I'm here to prove you right on They Say I'm Too Loud.
Hi, everybody, and welcome back to They Say I'm Too Loud. I am your host, Nubuke, and I am already predicting that this is about to be my favorite episode this year because I have a very special guest here, Dr. Karen! And I'm so excited because I think that there's a need to talk about so many things. I think there's a need to talk about health. There's a need to talk about education. I don't know, I love absorbing information. And so when you clicked on my page, I promise I don't think I've followed anybody so quickly in my life. Because I was like, oh, gynecologist, follow. I think the only other person I followed so quickly is this HIV health advocate. Because I was just like, where are you finding me from? Because I'm so different from this
But
field.
actually, I was really drawn to your profile, your vibe, your personality, and maybe that's my alter ego.
I love that. I love that. No, but you're also very present and very lively in your videos as well. So please, can you tell me a little bit about your background? What's your official title? Because I know you're as Dr. Karen, but doctor could mean that you're an anesthesiologist. It could mean that you're a general surgeon. Could you tell me a little bit about what you do?
Yes. So I'm Dr. Karen Aminiampon. So it's med doctor now. They say we add med to it. So I am board certified, trained as a consultant, obstetrician, and gynecologist. So I take care of women's health and women who are having babies. So everything women is my field.
Okay, I love that. Everything women. Well, we have a couple of questions, and I feel like in preparation for this interview, people sent some of their problems. So I want to throw that at you and just see what lands, doc. So this is from somebody who is sexually active, and they go, my partner swears by the pull-out method and his legendary self-control. But I've heard that it's basically playing roulette with ovulation. Is there any scenario where this works, or are we just being delusional?
Okay, so first of all, before we continue the podcast, I just want to lay out a disclaimer that this does not constitute a consultation and you should see your doctor if you have a problem. So this is just a discussion and it doesn't amount to a consultation. So see your doctor.
See your doctor.
Yes, okay. So pull-out method works for people who have regular cycles. So if you have a regular menstrual cycle, you're able to track your period. That's the first thing I'll say. If you cannot track your period, you have no business with the pull-out method.
Okay.
Because the second thing I want to say is that pre-cum can contain sperm.
Okay.
So if you're on, for example, your second round, or not you, if someone is on their second round, if someone is on their second round of coitus.
Sorry, mommy. And grandma.
It's educational content.
Yeah, educational.
So if someone is on their second round of coitus, and the man has already had an ejaculation and sperm has already passed through, the pre-cum can still contain the sperm. So already with pulling out, when there is pre-cum, you can, not you, someone can fall pregnant. Mm-hmm. So it's true, people have a lot of self-control and can do the pull-out method, but pre-cum can contain sperm.
Okay.
Or even sperms on the tip of the male organ can also cause pregnancy. It can also lead to a pregnancy. So caution with the pre-cum, girlies.
They said don't do it. They said don't do
Caution.
Caution, because you can end up being pregnant.
Yes.
So our next dilemma is from somebody who's a virgin. And it goes, I'm a virgin in my mid-20s and worried I'll fail at sex when the time comes. How do I prepare physically or mentally without overthinking it?
So firstly, sex is not dirty. We have to get that out of our minds. I encounter a lot of people who have challenges when they start having sex because they think sex is dirty. It's not dirty. It's natural. To be well prepared for sex, one has to prepare their minds, be in a relaxed state, and just go with the flow. But you can also read books. You can get checked before or when you start having sex, just to make sure that everything is fine if there are any challenges.
So you can actually go to like the hospital and say, hey guys, I haven't had sex before. Check.
Yes, you can. Because, for example, if you get a scan done, if there are any things that point out that sex might be painful, like maybe a low-lying fibroid or some lesion in the lower part of the reproductive system or tract, like the cervix, even from a scan, then you know where you're starting from.
That's so interesting because I know somebody who discovered they had fibroids because they became sexually active. And so this is a very interesting perspective that I guess I had never thought would be something that we need to think about even prior to like, okay.
And then speaking to people who have experienced sex, speaking to people both with their good experiences and bad experiences helps to build one up before.
Yeah.
But they say it's just like riding a bicycle, so she'll be fine.
So for someone with PCOS, this is from somebody with PCOS, and it goes, my doctor says losing weight could help my PCOS symptoms, but my hormones make me crave carbs like my life depends on it. Is this a losing battle, or are there PCOS friendly ways to hack my cravings and energy levels?
Yes. So PCOS is more common now than in maybe like, I'll say 2-3 years back. And personally, I have my own struggles with PCOS. Those who follow me or have been following me for a long time know that. So it can be a little bit challenging to lose weight, but seeing the right people, seeing a dietitian can help. So yes, I know it's like, I also yo-yo a lot with my weight. So one moment I would have lost relatively a lot of weight, and then the next moment I put it on easily. But with time, I'm able to pick out the things that help with the weight loss. And diet plays a very, very significant role in managing PCOS. Some people also find that when they take dairy products, it gets worse. So these are some of the things that she would have to figure out and try to see, and then speak to a professional like a nutritionist or a dietitian. And then less stress. Stressful situations make the hormones get out of whack quicker. So it's easier said than done, but she needs to have a lot of leisure time, relax, and kick out all the things that are causing stress. Yes.
Because even as I think about women's health, and so many things have come up that I think that if I didn't have access to the internet, they didn't teach us in school about PCOS, which, sorry, by the way, polycystic ovarian syndrome, which could manifest in like really bad cramps, yo-yoing with your weight. Come on, doc, help us.
Okay, so PCOS is polycystic ovarian syndrome, like she rightly said. And it's a hormonal disorder that affects women in the reproductive age. So from the time they have their first menstrual cycle till menopause. And some people's symptoms linger on even after menopause. So there's a triad. So 3 things that are used to diagnose it. The first is irregular periods. So when I say irregular, it's ranging from absent periods to spotting, even to some people manifest with heavy menstrual periods, not just the absence. And then clinical signs like having excessive hair, which is a sign of excessive testosterone. So like a beard, a mustache, balding in women, hair loss, that
I have like a
chimfoteco.
little bit of a bald
But it's
spot.
not, it's
Oh,
not,
okay,
it's
sorry.
not.
Okay.
And then male pattern distribution of hair. So males usually have hair going up on their abdomen and then hair on the chest as well. But that's not to say some people are hairy, so that doesn't constitute PCOS. And some cultures like Indians have a lot of hair, so you can't really use just that. And then also with lab sampling done or blood taken, you find that the person might have high testosterone. Then the last thing is finding a lot of what we call polycystic
Ovaries?
Yes.
Okay.
So both ovaries or one ovary might have a lot of tiny follicles.
Okay.
So that is the diagnosis. But having that on the scan does not necessarily mean you have PCOS. So the 3 things I've mentioned, the diagnostic criteria says you should have 2 out of the 3 things. So those are the main symptoms.
So at what point in time did you discover that you had PCOS?
When I read the textbook, when we got to that topic.
Oh my God.
In
So
med
like
school.
this whole time.
I didn't realize it was that.
What did you think it was?
I didn't think there was anything
Wrong with you.
I thought it was my norm. I thought it was because of stress of boarding school and medical school. Till I got to the chapter in the book.
And then what was that like? Like discovering, oh my God, there's finally vocabulary for...
It's funny because I didn't think there was anything wrong with me.
Okay.
I thought it was normal to skip some cycles.
Yeah.
In the year, or to have like a long stretch of not having a period.
And it's only when you became a doctor. That means there's so many people.
But I grew up in a medical household. I think they knew my diagnosis, but nobody told me. My dad is a gynecologist and my mom is a midwife. But the thing is that most of the textbooks in the house were on pregnant women. So I knew more about pregnant women before going to medical school. Then we do gynecology and then I'm like, oh. So I had PCOS. But it was fine.
It was fine.
Because it's... You know, the diagnoses that usually scare people are cancer.
Okay.
So once it's not like, oh, it's not a cancer and it can be managed, then like I was fine.
So do you think that growing up in a household with people that were already invested in women's health, do you think that's what influenced you to go down this path?
I think my dad was on a mission because he used to take me to work a lot.
Yeah.
When he worked outside the country in Saudi Arabia, we used to go to the hospital with him when we visited him. And then when he came back to Ghana, I remember going with him on weekends to Kolibu when he worked there. And then he also used to go and do scans in Accra, somewhere in Mamprobi.
Yeah.
I used to go with him and I didn't even understand. He would point at the screen.
Yeah.
And that was like him subconsciously.
And why women? Because I think that you've carried this mission all the way through to TikTok. So you've built quite a big following on TikTok, just trying to educate people about women's health. And I'm thinking you could have gone down so many different paths. Like, why did women stick out?
Well, I wanted to be a pediatrician, even though so a pediatrician is a doctor who takes care of kids because I love kids. And I used to go into the labor ward in my dad's hospital when I was very little, like, out of bounds area and then watch women have babies and then like play. Yeah, I used to play with the babies.
You used to play with the babies.
So I really love kids.
Sorry, that's so adorable to me. I don't know if this is like, I should be scared. Should I be scared?
About me loving kids?
No, about like playing with the babies when they're like, what, freshly born?
Oh, like not like touching them, like touching them through their clothes. Not. I really wanted to do pediatrics, but I had an experience. My first rotation after medical school was in the pediatric department in a teaching hospital, in the biggest teaching hospital in this country. And they put me on the oncology ward. That's the cancer ward. So my first experience working as a doctor was with pediatric oncology. That's childhood cancer. And it was really traumatic for me. It involved taking multiple blood samples from these little kids. They'll be crying. I'll be crying. The parents are crying. Most of these children passed away because the diagnosis was late. Like the number of kids who had cancer on that ward, the turnover, it was crazy. So my first rotation working as a doctor got me very depressed, seeing these dying, crying kids. So that really, really took me off. And then I came to my original love,
which is women's health.
So that's how come I ended up doing that.
Okay. Our last people's problem is about sperm quality. So it goes, my husband lives on energy drinks, fast food, and vaping like it's his job. We're trying to conceive, but I've heard sperm health matters too. Should I stage a pantry and vape intervention, or is this just guy code nonsense? And I want to add to that a question that somebody had asked recently about when you first enter a relationship with somebody and you guys become sexually active. Their pH balance of what their previous partners or something, does it change your pH balance? No. Doc, over to you.
Okay. When it comes to fertility, interestingly enough, it's not just a woman problem. In most of the cases, couples we see, the fertility problems are 50-50. So 50% from women, 50% from men. Most couples, the men also have problems. So when we talk about male infertility, we are talking about problems with the sperm count and the quality. Research has proven over and over again that smoking and alcohol play a big role in reducing the sperm counts and quality. So we're not just talking about the count, the number. We're talking about abnormal forms. Sperms have head and tail. They might have very big heads, no tail. They might have 2 heads.
And they're able to swim?
If they have all these abnormalities, then the fertilization is going to either not work, or if there's fertilization with the egg, you're going to have an abnormal baby. So men, it matters as well. Men think that energy drinks help, but they actually don't help. They contain chemicals which have far-reaching effects, not just erectile problems in the long run, but their kidneys can also be affected. So they need to take really, really, really good care of themselves.
Because I read or saw this video, and in prepping for a baby, this couple did like 9 months before she got pregnant. He was like eating healthy. He was like in his vegetable era, like doing all of these things because he wanted to make sure that the sperm quality was just as good. And I mean, she was eating fine, but it was like during the pregnancy where she was like hyper focused on every single thing that she's eating through the different phases. So that's when it occurred to me, because apparently nausea, morning sickness is tied to like the sperm quality as well. I was just like, wow, like there's a lot again of women's health research that we're missing out on. So speak to me a little bit about the pH balance thing.
So the pH balance thing has to do with, well, the first time people meet or have sex or have a new partner, they realize that they might be slightly thrown off, and it manifests as ranging from a fishy odor to increased discharge to itchiness. We all have bacteria on our body, good bacteria. That is normal for us. So I have my own bacteria. You have your own bacteria. The next person has their own bacteria, which is good bacteria. But everybody has different types of bacteria. So you have your own kingdom of bacteria going on all over your body, in your intestines, your guts, everywhere. Your ear, your eye has its own. So when 2 people who have never met or had sex before, or they've had sex before and then gone and come back, there can be sort of a throwing off, especially for females, because our vaginas are very, very sensitive. They have their own bacteria going on, which keeps us at our own pH. So everybody has their own pH, which should normally be in the acidic range. So if a new partner comes in, they bring their bacteria. So this mixing of the bacteria sometimes can cause imbalance. So it's like a new kingdom going on. And then that's where the discharges, fishy odor, funny smell, itching comes in.
Is that also why it's so dangerous when people like kind of like step out on relationships or have multiple partners without disclosing it?
Yes.
Because then it's throwing off your pH, and God forbid it's putting you in danger as well.
So that's bacterial vaginosis, BV.
Okay.
So BV is basically imbalance in the flora or the bacteria.
And can you get that just from meeting a partner who's not, sleeping with multiple people?
Yes, you can get that. So it could be a partner who is also not sleeping. It's just the different bacteria between 2 people. But if there are lots of people in the mix, then it's like a whole petri dish going on. So that's how come it happens that way. So it's not like an STI, like there's an organism, like a particular one, like gonorrhea, which is being transmitted. It's just the throwing off of the pH.
Okay.
Yes, people get that from using things like vibrators.
Yeah, because it's gonna throw off the pH and stuff. So you mentioned STIs. Could you tell me a little bit about exactly like what an STI is, and then also how do you protect yourself if you're sexually active or you don't know if your partner is?
So STI means sexually transmitted infection, or STD, sexually transmitted disease. So these are diseases spread by sexual contact. So when I say contact, that means that it's not just the actual coitus only. Anything like digital, finger, genital to genital, that's considered STI as well. So it's not just the actual act of sex.
Yeah.
So we have different types.
And also mouth herpes.
Yes. So mouth is also part of, So you can have, and throats. So you can have not herpes, but like warts.
Okay.
Yes. So you can have STIs being transmitted in multiple ways. There are different STIs. So when someone comes and says he wants STI screening, the history is very important because what type of sexual contact is it? Do they know about other partners? Do they have other partners? What are their risk factors?
So what would be on an STI test if this is what you're coming to ask
As
me?
much as possible, But the questions will guide, and also, I
Okay.
mean, some of them are quite pricey, so that will also guide.
Yeah, which is why you need to be very honest with the
Yes,
test
yes.
if you want the right diagnosis.
And herpes, tell me why herpes is coming up so much. The number of herpes
cases.
Yes.
So that's part of the reason I really, really wanted you to be here, is because it has been an uptake and an uptick in STI cases like in Ghana. And I feel like it's very important for us to know how do you navigate through this. So which is why I asked you, if you don't know if your partner is
assume they
Yeah.
are.
Oh, okay.
So regular testing. So I'm going to run through quite a number of STIs.
wow.
So let me start. When we're testing, you can do blood tests, you can take swabs. So let's go through the most common one. Like, let's say there's HIV as one,
Yeah.
which is the one people get really scared about. But there are other ones you should be scared of
Yeah,
too.
yeah.
Okay, so there's herpes. You've mentioned herpes. So herpes can affect any part of the body. So the common ones are like on the lips and then on the genital area and the anal area as well. Then we have gonorrhea.
Mm-hmm.
There's syphilis. There are warts, which can be associated with cervical cancer. So warts cause the warts are viral.
Okay.
So we have HPV,
Okay.
human papilloma virus.
There we go.
I think this is like a whole conversation as
Please.
well.
Yeah,
Okay.
yeah.
So HPV,
Okay.
which leads to warts.
Okay.
And warts are the non-cancer manifestation of the HPV.
Okay.
We have HPV also causing cervical cancer.
Okay.
Yes. And then there are so many other ones. So anything abnormal, even lice can be sexually transmitted. Yes. Some people have lice in the pubic area. So it's a whole lot of things.
Sorry. How does
Chlamydia.
one treat
Lice.
lice in the pubic area?
Use a lice powder or the shampoo.
The lice
Shave
shampoo.
all the hair off. Yes.
Huh.
So there are a whole lot of things. There are so many.
Use lice shampoo.
Yes. So let me come back to
Please.
cervical cancer. The reason why there's a lot of talk about cervical cancer is that it's one of the cancers where, if picked up early, it can be treated. So it can be picked up even before the cancer actually starts to happen. So
And
there's
it's the only reason you get cervical cancer is one of the can you only get it through having sex?
So 99% of cervical cancer is caused by HPV, which is the human papilloma virus. And the human papilloma virus is spread through sex. It can be spread to babies as they pass through their mother's canal during delivery, but it's spread mainly through sex. It can also be spread through digital contact. So someone touches their own genitals, they have it, and then they touch you.
Wait.
Yes.
Like, as in, it's not even like they're touching my genitals. They're just touching me.
Yeah, okay, so you can get what's caused by that on your body, but then the main place where it easily will spread is in the genital area. Yes. So no, it's not like it doesn't happen like that a lot. Okay. Then the other 1% of people who get cervical cancer are not sexually transmitted, so they are virgins. There's that as well. Is those who are at risk because their mothers took a medication called diethylstilbestrol, but that DES is no more prescribed for women who are pregnant. So that 1% is...
Wait, so there was a world where people were being prescribed drugs that actually gave them
But they didn't know. No, they didn't give them HPV, gave them cervical cancer.
Oh.
Yes. So cervical cancer, the main thing is HPV. Then so 99%, then the 1% is those people.
And there's a vaccine now for HPV.
Yes, there is. And now they are trying to introduce it. I saw a letter last week from the government saying that they are going to introduce it to the national program. In other countries, it's part of the program. Girls between the ages of 9 and 12, and boys as well, because boys are giving the girls the HPV, are getting the vaccine. So it's something the government wants to introduce, and that will be really good, because if people get the vaccine, then it can prevent cervical cancer, or most cervical cancer. Okay. It's not going to be against all the strains. There are a lot of strains of the virus, but it will prevent against a lot. So there's a lot of conversation about screening, and we only do screenings when we know there's going to be an intervention. So that is why there's cervical cancer screening, and that is in the form of pap smears.
Yeah.
So pap smears are tests done where you take samples of the cervix are taken a pathologist will have a look at it and then say, this is normal, this is precancerous, and then this is cancer. And cervical cancer can take about 5 to 10 years before it actually develops from the time the precancerous lesions are seen. So it can be treated, and that's why there's screening. So that's why pap smears are encouraged. And then HPV testing is also one of the things that has been added on, because if the pap smear is normal but there's HPV, then it gives you the heads up that the person needs to get tested or checked up frequently. So people should get their pap smears. It's not painful, a bit of discomfort, but
okay.
yes. So if someone is sexually active from a very, very young age, like say 12, 13, then I won't say the person should wait till 25 years. There are guidelines for getting a pap smear. So she can get the pap smear from the age of 21. HIV positive people also need to get frequent pap smears and early. Some people are born with HIV. So early from the age of 21.
Okay.
If not from 25 years. Now, as to how often it should be got, the guidelines keep changing. So there are international guidelines that we go by. Some years they say every 3 years. Some they say every 1 year. So I would say whatever the person is comfortable with. If you're comfortable with getting yearly pap smears, please do it. If you want to go by the guidelines of your country and it says every 3 years, that's fine. But if one can do it every year, that will be fine. People shouldn't be scared of what the results will be, because if they survive, it's one of the cancers that's easily treatable if caught early.
So I want to steer into another topic that has been coming up recently. And okay, I'm going to quote from an old paper, and by old I mean 2020 report from the Guttmacher.
2020 is old.
2020 is oldish.
What era do you belong to?
Are you 2025 era is what I belong
Gen Z?
I'm a Gen Z. Okay.
I'm vibing with a Gen Z.
You're vibing
Millennials.
Okay, so I want to quote an old paper from the Guttmacher Institute, which says, according to Ghanaian law, abortions are legal in cases of rape, incest, fetal abnormality, or disease, or defilement of a female idiot, is what it says. Or if they are performed to protect physical or mental health. They must be provided by registered and trained health personnel in an approved facility. So I think this is a pretty wide-ish umbrella, especially the bit about physical and mental health. And again, I'm not here to debate the ethics of abortion, whether you believe in it or not. Go and ask your grandfather. But what I'm more interested in is the perspective of what happens when it's done. I mean, the paper said over 53% of pregnancies where it goes on to talk about how 53% of the terminated pregnancies were unintended. So I guess my question in terms of aftercare is, how many times can one get an abortion before that constitutes as too much?
Okay, so abortions, we call it terminations of pregnancy. This is the legal document or paper. So yes, in Ghana, terminations before a certain number of weeks are legal and must be done by the rights. It shouldn't be done illegally. It should be offered. So if someone says, this pregnancy was not planned, I don't want it anymore, it's going to cause me mental distress, that's her reason for having the termination. So there are facilities and institutions where it can be done, even in the government hospitals. I'm not here to judge how many terminations are too many. But what I would like to say is that if someone keeps having terminations, then they should be offered contraception or family planning. So contraception is a method to space or avoid pregnancy. So in order not to keep going through terminations, then even with the terminations, when people offer terminations as part of the counseling, there's a part where they're offered counseling on contraceptives.
Yeah.
And they have to be offered. They can choose to decline. Some people don't know there are contraceptive choices or don't even know which one will be good for them. They've heard of only one method. So that's an opportunity to present and not judge the person, present to them the options so that they don't keep coming back for terminations.
Yeah.
Because terminations,
it's very hard on the body.
Yes.
Yeah.
And it will be better for the person to have a method where they can prevent the pregnancy, especially if it was an unintended one.
Yeah. And then in the same vein, how many times can you get a plan B? And what exactly is a plan B, Doc?
So plan B, postinol, emergency contraceptive, Lydia. Hey, you people be popping them and coming to me. So plan B, postinol, Lydia, emergency contraceptive is not a pebble.
Okay.
So please don't.
Noted. It's not a pebble.
And I would say once you've taken it once, twice in a year, it's going on to 3, 4, 5, then it's time to consider a contraceptive method.
Okay.
So there are so many options.
Okay. So because there's so many methods of contraception, when you find yourself at like permanence or not permanence but very hard ends, I'm trying to put plan B and terminations in the same bracket, just so to put it into perspective that these are not easy processes for the body.
Yes.
Then it means that you should be talking about like family planning at this point.
The emergency contraceptive pill was made because people might be in their fertile period and then have sex, but it can't be it wasn't intended or made to be used every single time.
Yeah.
So it shouldn't be taken I have people come to me and they've taken it like, I took it today, then I took it again. Then it means when you start like that, I know you don't know your menstrual cycle. Because how do you take it when you're in your period? Even though it's true, you can get pregnant while you're in your period. Or how do you take it when you are just about to start your period? It means you don't understand your menstrual cycle. But again, not to judge or anything, please let's not pop the plan Bs just like it's like a pebble or toffee. It disrupts the menstrual cycle. So people have irregular menstrual cycles and there are long-term effects of that. Sometimes it might even contribute to struggles with having babies later. Sometimes it might be a contributory factor. So please,
yeah,
if it's going to be done twice and then now the third time in a span of 12 months, then it might be time. There's nothing wrong with having contraception. Just finding the right method is what's important.
Okay.
I mean, find something safe rather than popping these pills.
Okay.
Often.
So now the other side of the spectrum, which is for the non-sexually active at all, the virgins. Because I find that there's not enough conversation about the transition from not sexually active to sexually active. I think the first time this really occurred to me was when I read the book called The Great Sex Rescue by Sheila Ray George, and it mentioned vaginismus. And then I started having conversations with a lot of like my virgin friends who are now transitioning into being sexually active and the problems that came with them. So can you please shed a little bit of light around vaginismus? Tell us what it is and, what does it look like to prepare for it? And is there a cure? And then my second question is, what is the learning curve that one has to know in the transition? Okay.
These are very intellectual questions. I feel like I'm defending a thesis.
Yeah, defending a thesis. No, because I feel like half of my friends are virgins and then half of them are sexually active. And so with the exception of when the virgins and the sexually active have conversations, I feel like from a medical perspective, there's so much that we're not learning and there's not that many good resources to learn about sex, right? So the alternative is to turn to unrealistic descriptions of what sex is. So you're talking about the porn, you're talking about the books, you're talking about all of these things, right? And there's nobody that's actually talking you through, okay, so this is what the transition looks like. So anyway, could you please talk to me a little bit about vaginismus? And then I'll come back to like my other questions as well.
Vaginismus is a condition that affects women who have a vagina. So the vagina is made up of muscles and vaginismus mainly means tensing of the muscles. So it can happen, and in this context, we're talking about during sexual intercourse. So there are different causes of vaginismus. Some people actually have medical reasons why they have vaginismus. All vaginismus is medical, but some people have conditions. So some of the vaginismus or majority of the vaginismus is with anxiety around sex, and some people come around after some time, like they get better, they get less tense, and they don't have the vaginismus anymore. I would say that a lot of people have biases and misconceptions about sex. First of all, again, people think sex is dirty, but it's not dirty. It's a normal act. So when I say dirty, I mean like religion. It's unclean. It's this. It's not dirty. It's just a normal act like sneezing or coughing. Just that is between two individuals.
Oh, yeah, we're sneezing and coughing
two or
together
more.
in the bed. Yeah.
You didn't hear the last, but two or more.
Oh, two or
individuals.
Two or more. We're sneezing, we're coughing with 2 or more people.
So after some time, when people realize that, when people realize that it's not dirty, then they begin to relax and then they can enjoy it better. There are other people who have structural abnormalities that make, or structural differences. First, there are differences and then there are abnormalities. So someone might have a slightly smaller vaginal canal, or it's just going to take a bit of time, or maybe their partner are slightly bigger and they will need a lot of time to get accommodated or change in position. So that will help and then they'll relax. Then there are people who have actual abnormalities. So maybe it's a blind ending vagina, meaning it just ends there. Some people have abnormalities they are born with. There's just the vagina, then it ends as a wall. There's nothing else. So there are variations like that. Then there are actually people who have medical conditions that lead to the vaginismus, ranging from being depressed, from medications they are on, actual chronic conditions like
assault
diabetes.
As well.
Pardon me?
Assault as well.
So people also have mental health disorders that lead them to having vaginismus.
Okay.
Yes.
So
it's a big topic
that needs to be talked about.
And it also comes under the topic of chronic pelvic pain in the medical textbooks, because it goes hand in hand. Some people have the vaginismus, then have the chronic pelvic pain, then you need to investigate. So when a patient comes with vaginismus, it's a whole history, and it's not just a one-time thing. You have to see the person, offer counseling. They might have to see a therapist if it involves that, trying to get to the root cause of it and everything. But
so is there a cure?
So if it is something related to anxiety, taking away the anxious thoughts or the belief, or it getting the thoughts surrounding or the myths surrounding sex getting better, or the cloud lifted, like all the things that they have, the misconceptions going away, then they enjoy. All of a sudden they are relaxed. If it is something like a structural problem, then that would need to be addressed. Yes. So it depends on the cause.
Yeah.
Yes.
Yeah. So again, this is why you do need to see a medical professional so you can talk about this a little more. So what is that learning curve? Assuming, or let me take the root of the mental aspect of it. So assuming that you just, I'll take religion, for example. In Ghana, there's a lot of religious stigma around having sex. So what is the learning curve that one has to know in that transition from being not sexually active to sexually active? Like, where are you grasping all of this information from? Where are you learning? Because some people, the first time they're having sex is when they get married. Or I would say that's a lot of times that is what happens. So over to you, Doc. What does that learning curve look like?
If people have questions about sex, they can see a gynae. So the female will see the gynae, and then that aspect. I'm coming from a medical, like, technical point of view. Some people actually come to ask questions about sex. People don't know where the different parts are, the clitoris, the labia. People think the vulva is the vagina and the vagina is the vulva. So really understanding the anatomy of the female is the first thing. So understanding our own anatomy is very, very important. And when I say the anatomy, just knowing what the parts are and what they do, that's the first thing. Understanding the anatomy is not difficult these days, because you can actually Google and then see. It's not like you're looking for porn images. You're actually looking at what it really looks like, and then the function. So the first thing I'll say is understanding the structures and the things that the body is made up of, the female genital tract. Even taking mirrors to have a look and see, oh, okay, so this is what the book is saying, this is what, and this is what this is for, this is what this does. Then practically having conversations with people you are comfortable with, or people they are comfortable with, people who have had experience, and then people who won't give them
bad advice. Okay.
Yes.
Okay.
And some people have very, very terrible experience with sex.
Yeah.
So yes, it's good to listen to those ones, but those experiences, sometimes listening to them can be a bit scary and overwhelming for people. So maybe a balance of the information.
Yeah.
So a trusted person, say an auntie, a cool aunt who can talk about it. Not say, oh yeah, collabone, so you want to know, but just to know what it's all about. Because eventually most of us would have to face a first time of having sex. So the conversation is important, but getting a medic to also explain things and then getting checked,
also
like
helps.
having a scan just before. I mean, a virgin can have a full pelvic exam. So just having a scan to see what you're
okay. No, so say that again. A virgin can't have a full pelvic exam.
Well, you can't put a device to disrupt the hymen.
Okay, but that's assuming that the hymen is still intact.
Well,
because they say it can break with a bicycle.
But if the person hasn't had penetrative intercourse, using the device when it's not intended, I mean, if it's not indicated to check, then there's no need to check.
Okay. So then you can have a pelvic scan as an alternative instead.
Yes.
Okay.
Because unless, I mean, usually you wouldn't find someone with a hymen asking to be checked. Like, to put, unless there's a condition that requires that.
To trigger it. What if people are just like, do you know what? Just check.
No, I've not encountered anyone.
Okay.
I personally haven't encountered anyone.
Okay. So, as a gynecologist, what are situations where women have thought they were the problem, then it wasn't them, it was like actually their partners?
The first one is fertility. So couples coming in trying for a baby. The women usually assume it's them, but then sometimes it turns out that it's either not just them, but their partners as well. So 50-50.
So I've read a book recently, and it's by an African writer, and you get to the end of the book and you find out that the husband, he had multiple wives. He was not fertile at all. And all the women stepped out of the marriage, and that's how they had their kids. And it is, sorry, did I spoil it for the people in the room? Sorry, okay. Next time, read the book, okay? And it's very fascinating because because the stigma around women that can't have children is insane. And sometimes it's not even the women in the first place. And so, yeah, I think it's a very interesting statistic that you said that. Guys, like, the thing is actually 50-50. And we should always check. So... yeah, I would even just encourage people that before you put the blame on yourselves, actually check from the medical professional.
So I would prefer this if there's a couple battling with infertility, the first visit should be the couple.
Yeah. Because
it's not the individual that has the problem. It could be that with this particular person, there's infertility, but with another person, so it could be lady A with man B, infertility, then lady with A with another man C, no infertility.
Yeah.
So it's not just treating one person, it's looking at it holistically. So my ideal first time fertility couple consultation is having both
people there.
And the outcomes actually, research has shown that the outcomes for couples seeking infertility treatments are better when at the first visit they come as a couple. And it's true. Look, when I say, why didn't you come with the other person? I mean, I ask that question because of what the research has shown.
What are some of the results? What are some of the answers?
Some of the answers. I want to check myself to make sure it's not me. If it's not me, then I'll bring him. Or he doesn't want to hear anything about coming to the hospital for infertility.
So how do you talk, for example, yeah, because you deal with a lot of times with women. How would a woman talk her husband through coming to do the checks if he's like, I don't want to hear anything, it's not me?
You can't force a grown man to come to hospital. So she will just have to find ways to get him to come. However, she will convince him. Usually you can't get involved in the domestic. Someone you've never met before. You're calling them to come to hospital. They know they need to come. So
okay.
And Ghanaian men sometimes do not like to hear of coming to the hospital to get checked. I don't know why. So maybe they can tell us why. You can leave it in the comments. Thank you.
Okay.
Yes, the other thing you asked, the interesting part about what was this roots question again? You said things that couples,
Yes,
women
yes,
think.
yes. Yeah.
So I want to look in the camera for this one. Can you show me which of the cameras?
Please, this is your camera.
You have treated your own self-diagnostic yeast infection over and over again. Is it really a yeast infection?
Is it bacterial? We learned this. Bacterial vaginosis.
Or is it him? Is it really a yeast infection?
So you said something earlier on, and you said always assume that, like, because I was asking you, like, what does that look like if you think your husband or your partner has multiple other partners, and you said just always assume.
Get tested, yes.
Always get tested.
Maybe that's my paranoia speaking, but always get tested.
Yeah, because,
and then get your partners also to get tested. And there are self-testing kits now, but it's better if you're not sure of how to navigate it, or if they're not sure how to navigate it, they can always come to the hospital. But it's very important to get tested, and also because I mean, if you tell the other person to go and get tested and you haven't got tested, it will be weird. But just get tested. People should get tested all the time.
Yeah.
And then also ask their partners to test, whether new or old. It's a difficult thing to navigate.
And navigate that. But again, it's very important because the STI rates in Ghana are increasing, and there's so much testing that needs to happen.
About how often to test, that's a tricky one. Are you going to test every week or every month?
So let me throw that question back at you. How often do I test for STIs?
How often are you changing your partners, you and the other person?
Got it.
Mm-hmm.
So if, for example, okay, good. So if somebody was very sexually active and they didn't have one particular partner, what is like a good range to like be testing?
So if you're changing your partner every single day, then you should be testing the person and yourself every single day.
Time. Yes. Yeah, because it's a new,
We're not judging. We're just advising.
I want a baby, but I'm a baby. So I'm not having a baby right now, but what does planning to have a baby look like? So my favorite word recently is DINK. DINK is double income, no kids. And I found out what this was, and I said, this is brilliant. I would very much like me and my husband to just earn money and just spend it on both of us and just cause a ruckus all around town. And then when we're ready to have kids, then we can start saving for their college and all of that. So there's this company, it's called Fertility in England. And one of the things that they do is they'll test your eggs and to make sure you have, a great, whatever supply of eggs so I can plan for having kids. What does the process look like if I want to have a baby, but like I don't want to have a baby now because I'm a baby, but I want to have a baby. So what is the process of family planning without like a particular like goal, like bullseye set?
First of all, I want to say I'm adding a new word to my Urban Dictionary,
DINK.
So you want to know,
what does family planning look like when I'm not actually... I don't have a family. I don't want a family anytime soon. But obviously I'm a woman. And obviously I need to know my eggs and I need to know the state of my body. So you've told us how I need to know my anatomy. Like just putting a mirror down and we're checking what's going on, doing a little bit of Google. What does that look like to family plan even if you don't want a family currently?
So there's the option. A lot of people are opting for egg freezing. But before we get to the egg freezing, to check, you're talking about checking your eggs. Yes.
Yeah.
So there's a test that is a hormonal test. It's called anti-Mullerian hormone test. So that's AMH. It's a groundbreaking thing a few years ago, which was introduced and changed the game for fertility because it gave an indication of not just the quantity, but the quality of eggs. And then it also gives an idea of how well someone will respond to fertility treatments. So if the person is going to hyperstimulate, that means overreact and produce too many eggs at the time of fertility treatment, or because the egg store is low, they might not respond too well to treatment. So that's for the AMH. And then there's something called the antral follicle count, which is a scan. So that's the way we check. I mean, the fact that someone is menstruating every month doesn't necessarily mean that they are should I say fertile? Yes. Because a 45-year-old woman approaching menopause can still be having her menstruation or her period, but then her egg quality and quantity is low. I'm not saying she can't have a baby. I'm using 45. I mean, there are people having babies at 45. So maybe let me use like a 49, 50, 51-year-old woman approaching menopause. Might still be menstruating, but might not be fertile. Not to say she can't fall pregnant. There can be one egg that can do the whole thing. So there are tests called AMH and antral follicle counts, which can be used to check the eggs.
Yeah.
A lot of people are doing egg freezing now as well.
Okay.
Yes. But I just want to talk about egg freezing in the context of freezing the eggs. I mean, it's a process where you take medications, you get as many eggs as possible, and then they do the retrieval, and then it's stored. Getting that number of eggs is like, say the person gets 8. It's not a guarantee that that's like 8. After it's stored, we do the egg freezing. When it's frozen, when it's time to have a baby, you go through the process of, it'll have to be IVF. Not all the 8 eggs can survive the thawing process. So some people feel like, oh, I put it in the egg bank, I'm fine, but it's not a guarantee. Remember, even a few months ago, there was a fire in one of the facilities.
And they lost all the eggs.
Yes. So,
hey God,
just caution with that. In fact, some people do multiple. They don't just do one time freezing. They'll do it 2-3 times so that they get a lot more. So that even through the thawing process, if some are lost, because
how many eggs can I freeze?
It depends on how many you get. So you are given medication. So you go, the people who want to freeze their eggs, they actually go through the process as if they are going to do in vitro fertilization, IVF. So they are given medications to stimulate the ovaries to produce a lot of mature. So the ovary has its fixed number of eggs already, but the injections are given to stimulate.
How many eggs do I produce in a month?
So there are eggs waiting in the ovary. There are follicles waiting to respond to the hormonal surges. Then usually one of them becomes the ogboro, like the lead, and then that is what is ovulated. With the egg freezing, we want more than one. You can't go through that process of the injections and all that, and then we just get one and then store. You need to store multiple. So we are looking at getting you at least 6 to 8. Some people are able to produce a lot and you get like 20. Yes. That's going on the side of hyperstimulation. Some people respond very, very well. So it's not just one egg we want multiple to store, so that even when it goes through the process of the storage, because not all the follicles or the eggs that we see are viable or good. Some might be empty, like the DNA material is not too good. Some the cell membrane or the wall is not too good. So you need as many as possible. So it's a good thing to do, but remember that some people do it and then they get the babies from it after they go through the IVF process, but it's not a guarantee, but it's a good thing to do as well. So it's an option. It's one of the options. Yes.
Okay. So egg freezing is an option for family planning. Yes. But what else? What else does family planning look like before there's a family in sight?
So if you're talking about family planning in terms of preventing pregnancy as well?
No, in terms of, again, I want to have a baby, but me, myself, I'm a baby. So I'm not having a baby now. I'm having a baby when I'm ready.
And then when you're ready, you have it. So stay healthy.
Stay healthy. Stay healthy, kids. Okay. So we talked about sex a lot. And so I kind of want to transition out of the topic of sex and
thank God.
Pregnancy. And I want to find out some of the myths that you've heard around women's health, around fertility, menstruation, and everything. What are some of the myths that you've heard?
Let me do the number one. Why do you walk into my consulting room, you see that it's me, a female, and you say, oh, it was the male I wanted to see, and you frown? Why? You did it. Tell me why. So what is it? I'm curious to know. Maybe this is the opportunity to find out, I don't have a problem with male gynae, but I'm a female gynae. Do people have problems with seeing female gynaes or female doc. Maybe you have a problem with female doctor, fine. But is there something about women preferring male to females? I've heard some people say female doctors are not as compassionate as the males, and the males will pamper you and all that. So is that one of the reasons?
Yeah, I'd be very fascinated. Yeah, if you've gone to see a gynecologist before, did you have a preference as to why you were picking a male versus a female gynecologist? Or
maybe those who open my door and see my face and say, "Oh, it's a male I want," they can tell me.
Fascinating. Okay, so tell me, what else are the other myths that you hear about women's health?
We've talked about most of the stuff. The myths surrounding male and female infertility. We've talked about vaginal discharges. People thinking it's more of yeast infections. What are the other?
Are there fruits and like stuff that make you more fertile? Like I heard recently that if I drink clove water, like that's why somebody was having plenty babies, because they were drinking clove water and stuff like that.
So I don't know of any documented research. So I work with evidence-based medicine. So I don't know any documented research about the drinking clove water and having babies.
Okay.
The other myth I've seen a lot is about vaginal steaming. Huintia, precase, cloves. This one inserted. What else? What are the other things? Garlic. Please, it's not a barbecue. It's not a barbecue. So please, you don't need all those things. Not you. When I say you. So we don't need all those things. The vagina is self-cleaning or cleansing.
Yeah.
The parts with the hair is called the mons pubis. The labia majora is the outer one. That needs mild. The outer, I'm not saying the inside. You can wash with water and then a mild soap. But the actual vagina does not need any cleaning, steaming, cleansing, purification. What's
all of them?
Distillation. No.
Okay.
Yeah, so that's one of the major myths also.
Okay.
And yeah, people also feel like they need all these washes to stay healthy. Yeah. But the inside doesn't need anything, just the outside.
On the note of the fruits and where it comes from, I think a lot of times it's because people don't want there to be extra chemicals or extra, I don't know, sometimes they opt for a natural option when they want fertility, which is why the fruits and everything becomes like ooh, I want to have clove water because this will help. As a doctor, would you say that natural family planning is like a viable option? Because I know you had mentioned, hey, do you know your menstrual cycle? You know, so like what are your thoughts on natural family planning and things like that?
Yeah, if someone knows their menstrual cycle well, I have people who have used it consistently. So the age gap between the kids is 4 years and they haven't used any method other than cycle tracking. And in order to do that, they've studied themselves well, they know. So they've used the dates. Some of them are actually able to determine from their cervical mucus how thick or thin it is. People actually use the basal body.
My goal will be to be so in touch with my body that I understand that if my temperature is raised just like this, it's go time.
So there are some people who actually have done that and it's worked. The spacing between the children is 4 years. So there's a place for that. People even use the whole beads method where they count the beads and it works.
Okay, what's that?
So then they know their menstrual cycle based on they're counting the beads. So they know when it gets to this bead, that's when I'm fertile. And it was used in the olden days. They planned their family. There was some spacing for some people. Not everybody had back to back to back. Yeah, so it works. And then coming to the foods for fertility, yes, there are superfoods for fertility, like avocado, almond nuts, oats. So there are foods that are good for the body because they are healthy options and they help the cells to maintain a good balance. And the cells include the ovaries and the males, like the sperm cells and all that. So diet is important also in maintaining good fertility or reproductive health.
I kind of want to slightly pivot into periods because nobody taught me how to use a tampon, a menstrual disc, pads, yes, but everything else I had to learn that on my own with a whole lot of tutorials. So I vividly remember one of my college friends calling us on the phone because we're all on the phone with this other friend trying to figure out, okay, so she was like, is this how you put on the tampon? And we're all sitting there like confused because we're like, I don't know, maybe like you need to put your leg up this way, maybe you need to put... So all of that to ask, again, there's so much information that we are missing. And as a woman who might be listening to this, as a man, send it to your sister, send it to your girlfriend, you know, or just like sit back and listen. What does that look like to educate yourself on women's health issues from a ground zero? Like, what does that look like to learn? Especially if maybe like the resources around you aren't telling you about these things.
So this is the major reason why I started content creation. So I was not going to do content creation, but I was having lots of questions from family, like cousins, like they'll ask some questions and I'm like, I thought this is like common knowledge. But apparently it's because I was in the medical field or born to a medical family that I had that knowledge. But even remember, I didn't even know about my PCOS diagnosis. I had friends come to me to speak about things relating to reproductive health that I thought were basic.
Yeah.
But actually, because the information is not there, no one tells people how to do things. Look, even people don't even know how to put on pads.
Yeah.
So I have a video where I'm like, this is how you put on the pad.
Yeah.
So in my view, there isn't enough information out there. If there is even information, most of it is wrong. There are so many misconceptions. There's lots of wrong information, unverified information. So it's really important to find the right places to seek out the information. Some of the places are like, for us as doctors, we go to the websites where the guidelines are. So each of us belong to a body. So it starts from there. It means that the people providing the care should be certified. And once you are certified, it doesn't end there. There's continuous learning because there's always new research. So from the top, the medics, the doctors should keep learning to stay informed so the information can be passed on. Then in schools, I'm really passionate about going to schools also to speak to people, to speak to kids. Because there's not going to be enough information for them. And even if they do find the information, it's not going to be right. So that means that there's a huge gap starting right from the time before girls actually have their period, boys hit puberty. So parents also play a part. The church, schools, communities, aunties, uncles, everyone has a role to play in making sure that the right information is out there. And when people ask questions, they're asking the questions because they don't know, not because they are naughty kids. So the questions should be answered in the right context as well, in order not to cause curiosity and then the person ends up getting the wrong information from the wrong people. So everyone has a part to play.
Yeah. Thank you so much, Dr. Karen. So do you have any last... what do you want the people to know about women's health?
So I want everyone to remember this. The three tenets or pillars of my practice or as a gynae are self-care. So let's remember to take care of ourselves, get our screenings, breast exam, breast scans, mammograms, pelvic scans. Even when girls are about to menstruate or have their first periods, menarche, they should be seen by a doctor just to make sure that everything is fine. So preteen girls, teenagers, adults, postmenopause, everyone needs to get checked frequently. So there are checks for everyone. So self-care, which includes the screenings and everything. And then knowledge. So let's try to know more about ourselves. That way, when there's anything unusual or abnormal, or when there are changes, we'll be able to know what they are and embrace them if there are things that are normal or natural. I find people every time saying, oh, when I turned 30, then I realized this. So it's good. It means that they were in tune with their bodies. They've realized that their periods have changed in their 30s. Maybe the cycle has become shorter or longer. So we should have knowledge so that when we are in tune with ourselves, we can apply the knowledge about ourselves and our physiology. Then the third thing I would say is get checked again. So that means that I've repeated it. It's important. Check. So number 2 and number 1 and number 3 are the same thing. So that's what I
Okay,
have to say.
check. Thank you so much, Dr. Karen, for coming on my show. I feel like I learned so much, and I'm like gonna go like read through my notes and like watch this over and over again and be like, okay, write this down and figure this
I
out.
learned a
as well.
lot too. So you have to give me all the books
got
that
you.
your book recommendations.
Yes.
And
It's
you-
called The Great Sex Rescue. It was a
Okay.
really like, it had all of these statistics about like women who with vaginismus, and yeah, I was
You're
like, wow.
very well read.
Oh, thank you.
Yes.
Woohoo! Cheers.
It feels